Good morning, I'm Dr. Bryan Hulsey at Foundations Chiropractic in Corvallis, Oregon. I am a board-eligible clinical nutritionist with well over 300 hours in functional medicine. Today I want to talk a little bit about how the immune system works and where most of the immune system is housed. Trying to clear up some of the confusion that I hear a lot with, I don't have any gut symptoms, I don't have any stomach symptoms, no constipation, no diarrhea. How is my gut involved? So here, we're going to try to start out with clearing a little bit of that up. So with the immune system, 80% of that lines the small intestine. So we're going to take a cross section of the small intestine here. So what I'm drawing is some intestinal cells here, and they have these finger-like projections that are called villi. These villi help with absorption of broken down food and nutrients. So we're going to draw a few healthy cells here. We're going to also draw what we're looking for with some of these issues. And we're going to draw a broken down cell over here. Okay, so everything that we take in, food that we eat is broken down in the stomach, pending that we're chewing enough, that we're making enough digestive enzymes. So all of this food comes from the stomach, and we get this bolus of food entering the small intestine here. So the food in itself that we eat can be an issue and cause inflammation in the small intestine. So the food needs to be broken down into small enough particles that now it could be filtered in to those finger-like projections here. So this should be broken down and go in to the intestine like that. So now we get nutrients from that. So our bloodstream is now just a few cell layers deep through here. I'm going to draw that in red so maybe you can see that a little better. But here is our blood. So that's flowing through here as well. So the first step we need to look at is this food being broken down well enough in the stomach? If it's not, then we possibly need to work on chewing. We need to look at what the stomach is producing for acidity as well, or hydrochloric acid. So some of these larger food particles, now, this could potentially cause damage to these villi. But it can also cause, we have a little spot weld that holds these cells together. And then now what can happen is that we can actually go after and damage that spot weld. So if that spot weld is being damaged, now this undigested food particle is getting in and could be getting into the bloodstream. So this is where a good portion of our immune system lies, is down and through here. So our immune system is down here trying to protect us from foreign objects. So we also have, I'm going to draw kind of looking like a Pac-Man cell. This guy, we're going to call this our antigen presenting cell. So we're going to remember that guy for later. So again, 80% of our immune system lines the small intestine. So now what is happening? We have undigested food particles getting in here. We have a break in our barrier system. Now, think of a burglar breaking into your house. What can go on? We throw off the alarms. There's an invader here. So now the immune system is on high alert for that thing that has broken through our barrier. So remember that idea. We have a broken down barrier. We have a potential for a broken down spot weld. But another way that this can be damaged, this is very common with celiac disease, is we actually get breaking down. We have, it's called our cell cytoskeleton. Now this cytoskeleton is made up of actin and myosin, or actomyosin, and this protein allows for ladder and train effect to transfer things throughout the cell. Now we can actually start reacting to those own proteins, and that's where we start getting cell degradation or breakdown of that cell. With the breakdown of the cell, we can start losing that villi height. So when we do that, we start losing absorptive surface. So when we lose, so a villi again and microvilli, this is our absorptive surface. Think of this, this is about the size of 2 tennis courts. So when this isn't working well, we're not absorbing nutrients like we should. So that we can possibly get breakdown of that cell. Now instead of nice shag carpet, we get Berber carpet. So we get loss of absorptive surface, and nutrients are just going through here. So this would be our case in celiac disease over here. So more common is we get breakdown of this spot weld. Now food is starting to get in and stimulate the immune system. This is only one part of how the immune system can be aggravated, though. So another situation, we can have parasites and bacteria here living in the gut. And when this happens, these guys can produce a force field. This force field is made up of lipopolysaccharide. The reason why it does that is to make a nice sticky home, as well as it can evade immune detection there. So it throws out this force field trying to evade immune detection. So now these bacteria have a good home, and they're gobbling up all of our good nutrients. So this is a way that can block absorption. But this LPS, we're going to remember that guy for later too. This lipopolysaccharide can come through, and again, it's now seen as a foreign invader to this immune system. So we can actually get antibodies to that lipopolysaccharide. So again, anything that we take into our mouth comes through here. We get digestion occurring, broken down food particles. We should adequately digest that, so now we can absorb nutrients. So if this is a normal stage here, we should be absorbing those nutrients, and now it gets into the bloodstream there, where they can be carried through the rest of the body and utilized by our cells and tissues. Now if we have too large of food molecules, let's say this isn't broken down well enough, we're not chewing well, we don't have good information from the brain or thyroid going to the stomach, we're not adequately producing hydrochloric acid, so that decrease in hydrochloric acid can now allow for too large a food molecule there. This also can happen with people that don't have enough protein. So our body stops production of hydrochloric acid, which its main goal, its main purpose is to break down protein. So this starts happening, again, if we don't have enough hydrochloric acid, that can set up a stage where we have too much bacteria, or we can have a state called dysbiosis. So too many bad guys and not enough beneficial bacteria can move in. And these non-beneficial or pathogenic bacteria can produce lipopolysaccharide. That lipopolysaccharide can now get through the intestinal cells there, or get through a breach in the system. This is an example of intestinal permeability or leaky gut syndrome. So the very common occurrence, they're saying most chronic conditions stem from this process. So again, this now can get into and aggravate the immune system and go anywhere in the body. Okay, I'm Dr. Bryan Hulsey. This is our first video in our step of immune system dysfunction and where it can go haywire. So join us again in our next video here. And we'll describe how the antigen presenting cell now sends out screams for help, and the rest of the immune system comes into play here.